Good morning, everyone. Welcome to Tuesday morning coffee chat without the coffee, unless you brought your own or you're having it at home. There you go. Somebody's got coffee in the audience. So we'll go ahead and get started. Welcome, everyone. Have a seat. I'm going to turn it over to Steve, who's got the first portion this morning, who will open us with prayer. And then Emily Endert will also have a presentation, followed by Hanifa from EMS Medical.
Let us just pause for a minute and just let ourselves become open to this moment in our conversation. Let the Spirit just abide with you. Almighty God, as we continue to talk and listen to the things going on at Covenant Woods, may your Spirit guide us in our conversation and draw us together and continue to make Covenant Woods a community. Amen. I just want to briefly say, you may have noticed the communique last week about the what was it called? Notices. Notices. We've made a few changes, and the reason for that is some family members, when you see the bulletin going across and you see the picture of somebody who's died, it can be kind of hard when you wake up every morning. There it is on the bulletin board. So we made an obituary folder in the Katy. And so you go to that folder and just check it every so often. You can see if, in terms of death notices. And also the notification will be on the table in the back of the lodge here on that behind the fireplace, and then in the parlor will be the notices of those two places. There's a table right there as you go towards the elevator on the left-hand side there. So as you're coming in, you can just kind of see them right there. Yeah. And then the other one will be in the parlor. So right there on that table against the window. Yeah. And the reason for that is because sometimes there's an update, and so I'm putting another picture out, and so it seems like every week we're having a notice, but it's not really that way. It's just because we're having updates, and so we're just trying to put it in a place where you can be more aware of it without look like we're having somebody dying every week when we don't sometimes. And sometimes we'll have more than one up there. Yeah. And then people who live in assisted living and healthcare who are direct admits, their pictures are used in those areas, but we'll put them in the obituary folder on Katy because some people know these people from the community, and so we want to make sure that was being advertised as well. Like we had a death last Saturday, a direct admit into healthcare, Robert Barlow, and so that's on there in the obituary folder today. Yeah. Any questions? Okay, I'll turn it over to Emily.
Good morning. I'm here to give you a brief update on the Debbie Committee. We talked about it in a couple of resident town halls, and we've been making progress, so I thought I'd just share that with you. First, I wanted to tell you, and I brought my list of who's on the committee so I don't miss anyone. The committee members are Tom Wright, Steve Scott, me, Melissa Flood, Haley Wupong, Dwayne Johnson, Christina Stillwell, Mary Corley, Naomi Willie, Barbara Furman, Pat Hunter Jordan, and Dontrese Brown. Now, you may not recognize those last two names, and that's because they're not part of the on-site Covenant Woods community, but they're part of the greater Hanover community. And they joined us in June at our meetings. So we look forward to what we can learn from them. They both have good strong experience in diversity, equity, belonging, and inclusion. Since April, we have been busy doing research and making sure that we're not giving incorrect information. We also have started our informational boards, and this actually was started by Abby Rodriguez from Assisted Living, who created this board for Assisted Living in June. That was the Juneteenth board, and we liked it so much, we said, well, we're just going to have it travel through the community. So it stayed in the Manor for a week, and then it came over here for a couple of weeks. And beginning this month in August, we're going to be highlighting something about diversity every month on a board. This month it is Women's Equality Month, and the celebration is actually on August 26th. So we've started the board here this time. It will next go to the Manor, and then we'll go to Manor East. So if you're interested in learning more about some of these topics, please check out the boards, but also ask your committee members, because we are trying to be sure that we understand all the differences. We also have started including Debbie updates in our employee newsletter, and the focus there is more on international diversity topics. So we'll have a short paragraph or two each month about that, and then something, and a short update on what the committee has been doing. And I'm excited to announce that Melissa and I are attending a diversity, equity, and inclusion webinar tomorrow, Thursday, and Friday. It's already here. And it's led by Shirley Davis, who is a very strong proponent of diversity, equity, and inclusion. She was a member of the Society for Human Resource Management, the national group, and she went back and got her master's degree, and then she started her own company. She's a very dynamic speaker, and I'm looking forward to what we can learn and bring back to you all here. And that is all I have for today.
Thanks, Emily. Any questions for Emily or any member of the committee? Okay, thanks very much. I don't see Hanifa. She may have thought that this was in the NPR, or she's running late. But what I can say is that September 1st will be the grand opening of the clinic for EMS Medical. We had that confirmation this morning. Hanifa's going back to Pennsylvania for some training from the corporate training that they offer all their staff. And we'll be adding another nurse practitioner starting September 1st. So look for more details in the communique around that. And if you've not pre-registered with them yet as a service or primary physician, certainly feel free to do so. I think that will make any transitions outside of Covenant Woods, in other words, like at the hospital and so forth, a little easier to transition back here to Covenant Woods. We've heard some concerns in the past about those transitions, and it's all about communication and care coordination. So if they can be of any help, please get in touch with them. I'll offer the other directors in the room if they have anything to share, and then we'll open up to some questions. No one else? Okay, go ahead. Please wait for the microphone.
What happens with the specialists that are coming in? Because a lot of them come in in the morning. So how is that going to interact with this more permanent clinic?
Sure. So there's space now in the clinic to accommodate the specialists who come, like podiatry and so forth. So there's adequate space in the clinic. Once we have the opening, you'll be able to take a little tour and see how the space has been reallocated. We've moved out the employee health component, so that no longer takes up an office space. Shavante still has an office in there, but it's been moved. So there is adequate room for the scheduling of the specialists who come. I'm sorry? Her role is similar to what it always has been, which is assisting with the independent living assessments, tending to some independent living residents as needed. Her primary role really throughout COVID has been employee health. So that's her primary function. But she is also a liaison for independent living residents in terms of health and wellness. So you'll have more resource than we've ever had before. Other questions about other topics?
I would just like to tell you about an experience I've had in the last week. I skinned my shin here, and it kind of got infected, and I was told by a nurse that was in a meeting with me, she said, "You need to get that treated." I spent 4.5 hours in the emergency room at the hospital, and at 6 p.m. I said I was still third in line, and there had been 2 entire groups that had come in and been treated and left, and there were 3 of us still sitting there, including a man that was brought in by an ambulance after a car accident. And the chief nurse came down and apologized because that's their heaviest day in the emergency room. They were slammed. So I left. The next day, I decided I would see about advanced care. I called to see what they could do, and they said, if you're under a doctor's order, we can come treat you. That's the first thing that I didn't know. So you might be aware of that if you call advanced care. So then I finally called my primary care physician because I knew how he is. He's slammed all the time. And they didn't have any acute care openings that day either. They said, call Dispatch Health. I've seen their car here. They said they would send somebody out between 6 p.m. and 8 p.m. that evening. Later on, I was just checking my messages, text messages, and it says we will be there at 9 o'clock in the morning, between 9 and 11. And I had my son coming down to take care of some urgent family business, and I said, don't come. So I've been treating it myself, and it's working out just fine. But I spent about 3 days trying to see a doctor, and I sent my primary care physician a message, and he came back and he says, the last 5 nights I've been at the casket. I don't know if it's family or patients. Either way, he's obligated to play a part in the end. So I'm looking forward to having more services right here.
Absolutely, yeah. I think that's all too often the experience anymore, particularly waiting for something that might seem simple but may become complex if it's not attended to. And that's our hope, that you have resources, not only EMS, but the clinic itself with Shavante, and then, yes, still Dispatch Health or other local health providers. For me, it's about creating a web of care, no matter what the issue is, knowing where you can go to receive the most timely service. So thank you for that. I appreciate it. And we do have great hopes for EMS to be able to provide that right here on campus. Yes, advanced care is also an option. You'll hear more about that as they come to do presentations and get to know them. Also a great resource, yeah, through Covenant Woods.
Okay. I'm a little confused about what we're doing with the medical and the clinic here. If I have a nurse practitioner right now in my doctor's office that I can call, should I keep that person also? Because I don't have a doctor. I couldn't get a doctor. So do I keep that nurse practitioner in the doctor's office and then have someone here as well? And are we treating people that are outside of Covenant Woods? Do they have that ability to come in here for treatment to this clinic? Who are we treating? Because you're talking about employees and independent living, and I'm just confused about all of it.
Sure. Yeah, great questions. Thank you. Let's start with the latter. So it is only for Covenant Woods residents, independent living residents, or employees. So that is it. Nobody else from the outside. The clinic will not be open to anyone else. As far as who you should have in your provider network, I think it's advisable. I would do that just to sign up with this agency as well, but keep your own. I mean, obviously, it's about relationships and having some options, in the moment, much like what was just described. If your nurse practitioner is not available, you'll have a fallback. And what I was talking about earlier, if you happen to go off campus for an event at the hospital, let's say, and you need to transition back, but your nurse practitioner can't follow you, then having someone here can really help in that care coordination. And that would be my recommendation, but certainly it's up to you. And we're recommending that you stay with who you have. But if you don't have someone, you can certainly join EMS Medical.
When do we sign up for here?
Anytime. They have the registration forms available at the clinic, and that process is already underway. Good questions. Are there any others from the left side of the room or in the middle? The right side's well represented. I appreciate that. Yes, sir. Microphone's on the way. Thanks, Tom. As usual, a round of applause for Tom for being the host with the microphone.
He's just interested in the steps.
I think so, but it works.
It might be helpful to have something available other than word of mouth, the whole host of facilities available. And there's a second ER on Route 301, and there's something on either Katy or a publication that says, you might look at all of these options.
That's a great suggestion. So I know Megan is here. We can put something like that together and put it on Katie and let you know that it's there. Yeah, there's a lot in this area. You should feel really good about the medical support, the clinical support you have throughout the whole continuum. But that's a great idea.
Talk to friends and neighbors who are down the northern neck or whatever, and and my sister down in Savannah, Georgia, where she got, I would call third-rate care. We're very fortunate here.
Indeed.
Maybe you addressed this on a meeting I missed, but I had a question about the therapeutic pool in the
lower
PT
level?
area.
Yeah.
I know it's not working, and I wondered if there's any plan for it to work, or there's a reason it's not being used. Thank you.
My understanding about that therapy pool in the lower level, and I talked to Tim about that a few months ago, because I too had that question as I stumbled upon that area, is that it had not been maintained, or there's a part that is too expensive to fix it. I'm not sure if therapy finds that area to be functional. Certainly seemed in proximity it would be, but there is no plan at this time, but we can consider all of that as part of our master space use. Right, and those of you who've been here longer than I have, has that therapy pool been used? And it's not usable. Oh, okay.
For people who want to swim. It's only a swimming pool. You're swimming against the current. I was in there one day with a friend because the other pool was out, and I need to do for my own rehab water exercise. And I stepped wrong and fell off that thing, and it really frightened me, and my friend helped me. But they should never have put that kind of a pool in. It is not appropriate for anybody who's not super athletic, and none of us fit that bill, I don't think. So it needs to be changed to a one-level pool like rehab centers have.
Thank you for that additional information. Yeah, I appreciate that.
It existed before the new pool.
I see.
Years before the new pool.
Gotcha. All right. Other questions or comments? Hearing none. Thank you very much. Enjoy the rest of your day. It's supposed to cool off this week, so enjoy that cool weather coming our way, 80 degrees. Who knew we'd look forward to that? But thanks, everybody, for attending. I appreciate it.